basically we would have discussed about the general presentation of the solution, and now you are very interested, and I'll get the phone, I'll say to you, you see, it's very easy. You open the phone, you see the CRP icon, you get into it, and the first part, it's about logging in, as I told you, about the security, so everything will be secured. And now I'll start explaining how is the recovery program going to work after you have the instrumentation into the cath lab. Basically, the patient gets out of the cath lab with 1 stent, 2 stents, more stents, depending on its condition and on his risk. He will be trained 2 or 3 days before discharging. He will be trained with this solution, with the application. So you can see that basically once you get home, the main button of the application will be the alarm button. So in case you have any symptoms that the devices won't determine, like chest pain, because you don't feel the chest pain, or dizziness, you get the alarm button. Once you get the alarm button, you have some general symptoms. You check the general symptoms, and after that, if you want, you can do a measurement of the blood pressure, if you want to do. So the blood pressure device will be put on hand, automatically it will transmit the data into the smartphone, and once you do all these measures, you just click send, and the information will be sent to the doctor. And he will be, like in, let's say, 5 to 10 seconds alarmed, and you will be back contacted by the doctor to see the objective symptom and what should we further do. Plus, from this, the alarm will be automatically started if you have the devices on you. So if you put the blood pressure and the blood pressure is higher than 140, the systolic blood pressure, automatically you'll have an alarm sent to the medical doctor. So he will contact you to see why is the blood pressure so high. The same things happen with the heart rate, with the blood oxygen saturation that will be entered into the smartphone, the thresholds for their normal value. After you do the treadmill test before discharging from the hospital, you'll have to perform a treadmill test to see exactly what is your condition or your cardiovascular condition before going out. So you'll be in the safe thresholds. Basically, the main thing of a cardiac rehabilitation plan is the recovery session. The recovery session that comes, it's about physical activity that you have to perform 3 to 5 times a week, but in a monitored way. So you're sure that you don't put your heart at risk. Basically, you have to have some allowable blood pressure ranges and some controllable heart rate that will be set after the treadmill test. During this recovery session, for example, you have the alarm, which is the most important part. The blood pressure has to be determined before starting the effort. You start the recovery sessions, which can be divided also, because you can divide the recovery session. You don't have to do all the 45 minutes at once. You can do 15 minutes in the morning, 15 minutes at noon, and 15 minutes in the evening. It only matters that you do 45 minutes per day at the proper heart rate. This is the idea. And after you finish the effort, you do another blood pressure measurement so you can see that you recover from the effort good and there's no problem. Afterwards, every patient will have to quantify his effort, how he felt the effort. It was very intense, it's hard, it's easy to do it, so we know exactly how it feels and how he is going. He is going in the right direction or in the bad direction. Also, he will have the possibility here to have the measurements independently whenever he wants to do the measurements for blood pressure, for the oxygen saturation, for the ECG, for the heart rate, for the alcohol consumption, which is interesting and it's risky for the heart, this alcohol consumption, so it don't get too high, it stays in normal values, and also for the stress levels of the patient. He will have a whole history of his trend from the beginning till the 7 weeks period of the rehabilitation. He will have also advices that will come in the inpatient period when after the coronary event, after the stenting, he will have some educational materials, video, audio, and written materials about secondary prevention measures on how to lose weight, how to quit smoking, how to improve your stress coping, and things related to improving the healthy habits, basically. All these things will come also into the smartphone so he can review them. It will be something like e-learning platform for cardiac rehabilitation at home. Another thing, it will be that he will have the treatment plan. The treatment plan will be inserted into the smartphone so the patient knows if he forgot, because older people usually forget what the treatment, lose their treatment plans that they got from the doctor, and they don't know exactly what is their daily treatment, and a nutritional plan. It's very important that the patient has a personalized nutrition plan to get to his goal, because most of the persons that suffer from cardiovascular disease are overweight. They need to lose weight. Most of them have different comorbidities. So basically, if you have kidney problems, you need to have a special diet for kidney problems so you don't affect. If you have diabetes, you need to have a special food plan so you don't damage other things on your rehabilitation plan.